Hi, my name is Josh. I'm a pharmacist with pharmacisttips.com. Here today to talk a little bit about the medication Simvastatin, the uses for this medication, and then we'll talk about the dosage as well as the side effects. First off, what is Simvastatin? It's a medication used to treat high cholesterol. Um, and treating that high cholesterol can reduce the risk of cardiovascular events. We're talking about things like heart attack and stroke. Technically, it's a medication known as an HMG-CoA reductase inhibitor. What's that mean? It just means that it inhibits part of the process when the body is producing cholesterol. This is from a family of medications that most people refer to as statins. In the name, you can see statin at the end. In the US, it's sold under the brand name Zocor. The regular dosage of simvastatin usually is in the 20 to 40 milligram range once a day. Again, the dose will vary. That's something your doctor will help you decide. Sometimes children, if they have a genetic disorder where they have high cholesterol, is typically when we see it used in children. They're typically started around 10 milligrams a day. It does come in an 80 milligram tablet. We do see that used less frequently. It seems that higher dose does put one at risk for side effects as well as interactions with other medications. So although we see that dose used, it's not used very frequently. So what's the best way to take simvastatin? How do you take it? It's typically dosed once a day. It's not used during pregnancy. So if you're on this medicine and you become pregnant, you want to contact your doctor right away. This does have effects in the liver, so we want to avoid excessive amounts of alcohol. You can chat with your doctor. Typically, 1 or 2 drinks 1 or 2 days a week is fine, but always want to talk to your doctor about that as it can affect the liver, and this medicine, again, is processed by the liver with or without food. And it does seem like it's more effective when taken in the evening. Again, if your doctor wants you to take it a different time of day, or if you can talk to them. But the process that it's inhibiting is more active at night while we're sleeping. So taking that in the evening may make the medicine more effective. So interactions, that's really something we need to watch out for with simvastatin. Niacin and fibrates, they're used to treat cholesterol as well. Typically people with high triglycerides will use these medications. These two can increase the risk of side effects with simvastatin. So although they are used, it just needs to be used with caution. We need to be mindful of potential side effects as we're using those. Warfarin, it prevents blood clots and it can affect warfarin. Again, we see them used together. You and your doctor just need to be hyper vigilant, monitoring labs and things to make sure no issues pop up. A grapefruit juice and grapefruit can increase the levels of simvastatin, and so that could put one at increased risk of side effects. Common antibiotic clarithromycin or the brand name Biaxin, that can increase levels of simvastatin. Typically, if your provider feels that you need to use clarithromycin for infection, the simvastatin is often stopped during that time period. You want to avoid the over-the-counter supplement red yeast rice. It has a similar compound in there. Again, it puts you at higher risk of side effects. St. John's wort may decrease the effectiveness. Again, that's an over-the-counter herbal supplement. And there are many, many other drug interactions. So you always want to talk to your doctor and pharmacist when you're starting a new medicine if you're using simvastatin. We just want to make sure there's not a interaction. If there is, if it can be monitored. So what are some of the side effects that we see with simvastatin? Um, Constipation, diarrhea, rash, nausea, stomach pain, muscle pain, headache. Those can happen. On people with the lower end of dosing, a lot of times they don't have a lot of problem, but we just do need to watch out for that. Some of the rare and serious side effects that can happen are some serious muscle pain, serious muscle damage. We're talking your muscles feel heavy, your joints feel heavy. You need to contact your doctor right away. And have them check that out. It can cause tendon rupture, liver toxicity. Your Liver functions will be monitored on a regular basis, so your healthcare provider can watch for some of those issues. Pancreatitis can occur, and blood disorders, as well as there's several more side effects that are rare but can occur. So you just want to be mindful. If you're just not feeling right or something feels off, be sure to contact your healthcare provider. The sooner the medicine is stopped, and we notice this, generally the quicker one will return to normal. I hope you found this information useful. I would appreciate it if you would subscribe to my channel. Um, if you found this information useful, always be sure to talk to your doctor or pharmacist when starting a new medication, especially simvastatin, but all medications. Let them know what over the counter, what supplements you're taking. We just want to screen for side effects. And you need to be mindful of side effects as well and contact your healthcare provider if you notice that. And you always want to watch for side effects. Thanks for watching.